Welcome to Unintended Purpose, a podcast of For Better Devices. In this podcast, we bring you tutorials on clinical and regulatory affairs and news and interviews with leading figures in the medical device scene. And in particular, we dissect and analyze the intended purposes of medical devices on the market. And that's where we want to start from today. So we will discuss the intended purpose of a cell saver, the AutologIQ from Medtronic. Before we start, we should say that we don't have any connection to Medtronic concerning their product or this podcast, so this is just our initiative. Here with us today there is Ella Kamoun. She's a medical doctor that works with our team, and she's an expert in cell saver and the clinical evaluation. So Ella, I don't know if you can explain us briefly what a cell saver is.
Yes, sure. Cell saver is a medical device that is used to collect, process, and returns a patient's own blood during and after surgical procedures.
Okay, that's very clear. So it's a very important device, and that is used during sensitive surgeries.
Yeah.
And it can really make a difference. So let's see how Medtronic described the AutologIQ.
Yeah.
So it says that it's an autotransfusion system that is intended for use in the collection, concentration, washing, and reinfusion of autologous blood. What do you think of this intended purpose?
I have a little remark about the autologous blood, because autologous blood can refer to the whole blood or any of its components. It depends on the context. But when using a cell saver, we used to collect RBCs and separate RBCs from the other components. So actually here we reinfuse RBCs, which are red blood cells, and not autologous blood. It's not the whole blood.
I mean, there are also cell savers that can collect PPP and PRP. These are the platelet poor plasma and the platelet rich plasma, which are other components of the blood. But from the instruction of use of this device, it really looks like the AutologIQ is concentrating the red blood cells, the RBCs, as you said. And this is not super clear from the intended purpose. So this is a little improvement that could have been done.
Yeah.
Now let's see concerning the target population. So I was a bit disappointed not to find a section dedicated to this.
Yeah.
For the audience, the target population is the part of the intended purpose where you specify the demographics of the patient, so the gender, the age, the ethnicity, and so on. So all demographic parameters that could have an impact for the use of the device.
Yeah.
And here I could neither find, whether it's meant for use only in adults or also in children. And this is a bit strange because, I mean, if I remember correctly, the literature clearly investigates both populations separately, correct?
Actually, children are a target population to be considered for cell salvage.
The other thing that I found not so clear is they mention patients with religious objection to allogenic transfusion. And I mean, this is also a separate population, correct?
Yes.
Because, if you treat patients who do not accept the eventual use of allogenic transfusion, you will have completely different safety
and risks.
Risk parameters that you have to separately consider in your risk analysis and also in your clinical evaluation.
Yes.
So, once we define the demographic of the population, the next step is to describe the clinical picture of the patient. And here, Medtronic writes that the areas of application may include, but are not limited to, the following. And they say surgeries, including general, cardiovascular, orthopedic, vascular, plastic, reconstructive, obstetric, gynecologic, and neurological, and also post-operative treatment areas. So this is often used by manufacturers as a description of indication, but actually there is a better description of the medical indication in the guidelines concerning cell salvage. Is this correct?
Yeah, so the guidelines are really precise, and they say that cell salvage should be considered for surgical procedures where blood loss may exceed 500 milliliter for adults or 8 milliliter per kilo for children.
Yes, so I mean they provide this very nice, very precise definition that does not force you to consider specific type of surgeries, And so it's a pity actually not to use it. It's provided by expert in a very well accepted guidelines. So that I think that could be an improvement in the definition of the indication.
Exactly.
The next step, the next part that we looked for is after indication, contraindication. So what should be what is the clinical picture of the patient with which you do not use the device. And here I was a bit surprised to read the sentence, the process of blood recovery is associated with few complications. Because it seems to be confusing complications with contraindication, which are two completely different things. So complication is what could be the consequence to the health of the patient due to the use of cell salvage. And it doesn't have anything to do with contraindication, which instead are, again, the symptoms, the clinical picture with which you do not want to use the device. And then there is the specification that the surgical team must consider the risk and relative contraindication of autotransfusion in any surgical procedure before proceeding with autotransfusion, which is trying to make a point, but not 100%. I think here, again, the guidelines give us a better indication. What do they say?
The guidelines are really clear about it. They say that there is no absolute contraindication for cell salvage, and that there is a few relative contraindications, which are a potential contamination of the aspirated blood with the bowel content, infections, tumor cells, and amniotic fluid or fat containing blood.
Just for those who do not know these terms, so absolute contraindication are really the contraindication for which there's no way you should never use the device, and relative contraindication are the contraindication that a healthcare professional, for example, should evaluate should assess whether the device is appropriate to use. And here, I think the risk, when you aspirate blood, is that you contaminate this blood with substances that could be toxic or could be damaging for the body. And so they list these substances very clearly. So these are the substances that you could aspirate during such a surgery, and it's a very good definition. So it's a bit of a pity not to use it. Then the next step, it's the benefit claims, and this part seems never to go exactly at the core of the claims. Not necessarily there are several benefits to autotransfusion. The risk of blood transmitted disease is eliminated. The related costs of autotransfusion are minimized, and so they make some points which are all correct, but they do not specify the clinical benefit parameters, because these are also well specified, correct?
Yes, they are well specified. We have the exposure to allogenic transfusion and the number of units of allogenic red blood cells used.
Yeah, so those are the two standard parameters used in the literature to assess the benefit of allogenic transfusion, and I think the core claims of the device should really focus on that. Yeah. So for the performance, it's a bit strange because on the website they seem to provide more performance parameters, more performance criteria than in the IFU. They specify some removal of substances according to the official guidelines for autologous blood processing, which are the AABB. And this is not reported in the IFU, so it's a bit of a pity as well. But at least the core performance parameter is presented there. So overall, what do you think of this internal purpose, Hela? If you had to rate it from 1 to 10, what would be your score?
Things that are really missing here and that are not clear and that can also be confusing. So if I should rate, I will put 5.
I think that the part with the contraindication is not particularly well written, but the core information is there, so I would give it a 6 to 7, because I think there are the elements. It could be quite significantly improved to make it more clear for the healthcare professional. Mm-hmm. So thanks a lot, Hela, for today's podcast.
Thank you for inviting me.
I hope that you had fun, and we look forward to the next episode.
Okay, thank you.
Thank you. Bye-bye.
Bye-bye.